Dan, in one of our discussions, we didn't have time to answer one question. It came at the very end, and I said, I want to ask you about this later. How do we manage the patient who was told, you know, the most you have is perhaps 3 more months, or with this condition, there is nothing else that I can offer? And what's your feeling about that? And what do you feel the doctor's responsibility should be when it appears that the therapy that's being offered isn't working?
Right. So this is a somewhat of a common issue for those who have advanced cancer, and after all the best medical treatment was offered, the cancer progresses. I think the first thing that I tell those who come to see me for a second or third opinion, and they say, I was told there's nothing else that can be done, I say, understand that the doctors are saying it for several reasons, but one of them is medical legal. Doctors have this, unfortunately, this medical legal responsibility to tell people how bad things could be and how bad things are and what's the worst that could happen. There are physicians that have been sued for not telling people how bad their prognosis is.
Right.
And especially the family members will come back and sue the doctor because they never warned them how bad this could be. And then, of course, unfortunately, it becomes a self-fulfilling prophecy. We know that. If someone is told, you have 3 months to live, some people believe it. And so that's the first thing. Second is, we know doctors and oncologists, in some settings, they're so busy that they have little time. And they're not able to make the time that patients deserve. And they find themselves where there's no other medical answer, and the fastest and easiest way is to say there's nothing else we can do, that you need to be on hospice. Fortunately, more and more oncologists are realizing that if there aren't medical questions that we have answers that we have right now, that we can be innovative. We can look at metronomic chemotherapy that we have talked about, going with lower doses of chemotherapy, looking at some of the new monoclonal antibodies, targeted molecular therapies, different combinations of things we can do from the medical aspect. If there is no answer there, if we don't have medical options, there are other things we can do to make people feel better. And whatever time is left, giving them an improved quality of life. So symptom management, palliative care, complementary approaches, and then of course hospice. That's not, hospice is a wonderful organization that helps people live. So I don't say there's nothing else we can do. I say, in medicine, the medications we have, we may have some limitations. But there are many other things that can be done, like the list that I mentioned.
But do you ever put dates, not dates, months on it, or days?
If some people want to know the statistics, I'll say, these are the statistics, let's look them up. These are the statistics. But then you have people that, and a significant number of patients who will live beyond those statistics. And especially when they're supported, when they're having an improved quality of life, their physical pain is controlled, emotionally they're feeling better, they're supported, and they focus on what you teach all the time. They focus on the day-to-day, focusing on the now.
Right.
And when they focus on day-to-day time with their family, with their loved ones, then time basically is not an issue.
Right.
And so for every person, I'll say different things. Again, it's about individualizing and customizing what we say and how we say things. But I may say that life-threatening problems could happen anytime. On the other hand, hopefully, you're going to do well for as long as possible,
Mhm.
and we will be supporting you. So there are things we can do.
But do you ever say, you know, I don't think you have more than another few days to live or a month to live?
Not usually. Only if someone is in fulminant liver failure, for example.
Okay.
And then the family needs to know that
Right.
usually that usually is a matter of a few days or a few weeks.
Right,
But otherwise, we don't know. We've seen,
Right.
you and I and many
that's for sure.
physicians and healthcare professionals have seen, especially in hospice, they've seen someone dying in their deathbed, and then something turned around and they started to get better. And they lived another few months, sometimes they live years. And
It's
those
amazing.
are the miracles that we see. We can't explain them, but they exist. So, for any person who's listening to this tape, and they've heard, or a loved one was told, there's nothing else that can be done, there's just a few weeks or a few months left,
Right,
they should know that first, it's not the intention of the doctor to be mean, it's just, that's a medical legal issue. And it was incomplete if these other issues are not brought up. Issues of comfort measures, complementary approaches for quality of life, and different things that can be done to make people feel better.
okay. Wow, it's still such a hard thing, you know, and because very often someone is told there's nothing else I could do for you.
Right.
And then they seek a second consultation or a third, and it's so painful. It's painful to
yes.
watch these people go from one physician to another, but there always seems that there's something that you could think of, that you could at least try.
Right, and so I'll look at, once everything was optimized, I'll look at options, metronomic chemotherapy, or some other clinical trials,
Right.
But what I will say is medicine and science limitations are not your limitations. That's what I'll tell them.
Okay. But there's something else I just came to mind. How do you manage the patient that you have a sense they've accepted where they are,
Yeah.
they realize that their existence, their journey through life has been a very fulfilling one, and they accept the fact of death,
Mm-hmm.
but yet the family
Right.
is trying
Right.
to maintain
Yes.
their life, and there's that conflict, and now the patient who maybe confided in you how they feel
That they're ready to go. They've
and
had enough.
now but when that same individual is with the family, they don't want to upset the family,
Right.
and so now you're it.
Yeah. So, again, for every person is different, and,
Yeah.
and both you and I and all the other doctors here deal with this
Right.
on a regular basis. When it comes up,
Right.
we deal with it, fortunately not that often, but it's our job first to help the patient, but then also to help the family members.
Right.
And with the caretaker group that you have, that's a great setting to help the loved one, the family members, understand that they need to take care of themselves and respect their loved one's wishes.
Right. But it's so
It's hard. It's very hard.
It's so hard.
It's hard, and
The one thing that I think, if anyone's watching, is that I don't think you have to wait till you're ill, sick, or have advanced cancer to finish unfinished business. Finish unfinished business every single day in your life. I think that is the key also.
very
Yeah.
well said.
Yeah.
Great.
Thanks.
Thanks.